Mr. Wray, I want to thank you for your patience today. And as you're aware, we do have a vote series, and I appreciate that you have reached out to local law enforcement when they do have that loss of life from their force and the tribute that you pay there. And I will tell you, in Tennessee, when I talk to people, what they're concerned about with the FBI is that they have agents that are going to tell the truth, because they know if they raise their hand and take an oath that they swear to tell the truth, the whole truth, and nothing but the truth. And rebuilding that confidence and integrity in the system, I think, is of paramount importance. So I appreciate that you are putting attention on that. I do want to talk with you about the opioid crisis. The opioid crisis has really taken such a toll in Tennessee. And we know now that it is more than double the deaths from homicide. It's actually 2.4 opioid deaths for each death that is from a homicide. And I know you've had the Appalachian Strike Force. I'd like an update on that. I know you issued the 50 medical professionals had an indictment issued by DOJ against them. They had issued 32 million pills. And we know that you are working on the fraud issues. We had a pain clinic with fraud issues. But when I talk to local law enforcement, most of the crime they're dealing with has a nexus with the drug issue. So talk with me a little bit more about how you're managing that, the strike force, how you are partnering with DEA and local law enforcement, and then the continued emphasis that you expect to have on the opioid issue.
Well, thank you, Senator. I appreciate your flagging the issue. I know it is top of mind for an awful lot of people in this country, as it should be. You may be interested to know that the very first of the 56 field offices I've visited was Knoxville, and I've actually now made my way around to round two, so now I've been to Knoxville twice, in addition to, of course, the Memphis field office. But the reason I bring up Knoxville is that that office, in particular, for example, has done some very good work in the opioid arena. I would say that overall, our focus on this threat is much like I said to some of your colleagues on a couple of the other threats that we face, is to try to figure out where do we, the FBI, best add value that complements what everyone else is doing, DEA, state and local law enforcement, and of course, in this arena, public health, et cetera. So what is that with the FBI? Well, one, we have, and you alluded to it, we have a prescription drug initiative. So that's where we're going after in the healthcare arena, medical professionals, pill mills, Medicare and Medicaid fraud, nurses, pharmacies, that kind of thing, because that's a big part of the problem, and that's a place where we bring unique expertise. Second, we have Safe Streets task forces all over the country, and those target gangs that are distributing the opioids and fentanyl and related substances. We also have something called J-Code, which is an initiative that's focused on disrupting and dismantling darknet marketplaces for fentanyl and other opioids. We also have, through our TOC, Transnational Organized Crime Program, a focus on the transnational criminal organizations that are a source of the supply. Cartels. So we're getting at that part. And then I guess the last piece I would mention is from a kind of an awareness-raising perspective. We have done things like partner with DEA on a film called Chasing the Dragon, which we put out in schools together, and I think has got a slew of YouTube hits, for example, and it's a way to kind of raise awareness from a prevention perspective.
Okay, let me ask you, J-Code, I know that right now we've got 30 child pornography sites that are operating on the dark web. This is on top of what we see through a lot of that is happening with a lot of the apps that are out there that pedophiles are using and that groups are using to traffic women and children. And I've had done a good bit of work on this issue, and it is just heart-wrenching to me. Is J-Code And as you're looking through that and at the cartels, are you following the human trafficking with that initiative as well as the drug trafficking, or is there an additional emphasis on that human trafficking component?
So it's a good question. I would say the J-Code initiative is a darknet-focused program that's more geared towards the opioid trafficking, the drug trafficking, and the related
Okay,
crimes.
does
But we
that
also
sometimes-
have darknet,
Okay.
all kinds of darknet efforts that are focused more on human trafficking and various other forms
And
of
I
criminal
would assume
behavior.
that at some point, there is a juncture, because right now, the cartels are making more money on trafficking human beings than they are on trafficking drugs, or that is my understanding. And we definitely want to get after that. Let me ask you one more thing. When it comes to the issue of illegal immigration, illegal entry, NCIC is not collecting re-entry data or prior deportation data on these illegal aliens. And when we talk about criminal illegal aliens, that is something that our local law enforcement has to deal with quite a bit. And if NCIC were to change their protocol and begin to collect and collate that data, do you think that would be helpful? Is there a value to doing that?
I think I'd want to evaluate more closely some of what would be involved, but I'd be happy to take a closer look at it.
Okay, that sounds great.